Chapter 2, Video 2. Today we're going to talk about sterile packages. There's different types of packaging for sterile supplies. The first one that we're going to talk about is the fabric wrapped package. The fabric wrapped package is items that are sterilized on site at the hospital. So they are sent down, put through the autoclave, they're sterilized on site, and then they're wrapped in a fabric package. Then we're going to talk about the envelope wrapped package. An envelope wrapped package is where one corner is opened at a time to create a sterile field. It may be made of fabric or it may be made of paper. So with the envelope wrapped package, you have to open this a particular way. And once it's opened a particular way, corner by corner, you are then able to, once it's opened, you have to open it a certain way. And the side that you open lays down on your surface. And this surface, the back side of it, I guess, would be contaminated. But the top side would be the side that you laid your supplies on. So you actually use the package to create your sterile field. And then we'll talk about the pill sterilization pouches. These are small items. They're wrapped in combination with paper and plastic. Both sides are actually peeled at the same time, and you're able to flip these over, and you're able to drop the sterile item onto the you're able to drop the sterile item onto the sterile field. So know the differences in those packages and how they're open. It is clearly defined in your chapter. So throughout your chapter, please go through all the boxes, read your chapter well, go through all of the boxes and understand what you're doing step by step when you're dealing with the sterile field and what each item is in the different classifications. That's very important. If you stumble across questions when you're looking through your chapter, please let me know. There's different indications that items are sterile. So please, again, let's pay attention to that and know what we're looking for and how we determine if an item is considered to be sterile or not. Commercially prepared items have been, they have writing on the outside of the packaging, so they tell you, items that are sterilized on site will have two chemical indicator strips. The outside strip changes color after it's been processed. The indicator strip inside the package will also change color to show the sterile agent penetrated the packaging. So please know what you're looking for as far as determining if you're dealing with an item that was sent through chemical processing on site, or if it was an item that was prepared outside of the facility and sold to the facility if it was prepared by the manufacturer. The sterility of items is maintained as long as the sterile package is stored properly and the packaged material is not damaged or placed on a wet surface. So one thing, again, that we need to remember when we're looking at sterile items and we're creating a sterile field, one thing that we need to remember is inspecting that package and making sure it's intact and that it has not been damaged or contaminated. We want to tell whether the following statement is true or false. Sterilized items usually reach expiration in about 1 year. The answer to this question is false because it's very important for us to know that items that are sterilized do not have an expiration date. As long as that packaging is intact and it's not damaged, they do not have an expiration date. When creating a sterile field, you need a sterile area where other supplies can be opened, arranged, and moved around, a place where sterile supplies can be opened in a manner that do not contaminate them or the sterile field, and sterile gloves to arrange and use sterile drapes within the sterile field. We are going over the sterile field in lab, so for those of you who have not already attended the AHS 110 lab, you will see this, and we will go over this in the actual lab when you come in, so you can get the hands-on idea of exactly what we're talking about. There's different procedures that require the use of a sterile field, and here are a few. Inserting urinary catheters. This is number one. Remember, we said in the previous video that there was a huge rate of infection that occurred with improperly inserting a urinary catheter. So this is one procedure. Giving injections is sterile, starting an IV line, and changing sterile dressings. So there are incisions and wounds that might require that you use a sterile dressing. All instruments and supplies and gloves hands remain sterile so that blank are not introduced into the body. The correct answer here is microbes. We use this sterile field to ensure that microbes are not entered into the body. When we scroll down, when we talked about the packaging earlier in an envelope wrap package, this is the idea of the envelope wrap package. So if you look here, she's folding it back in a particular way, in which we'll go over in lab when we get ready to go over urinary catheter. We will talk about sterilization in lab tomorrow again as well, and creating that sterile field. But this is an envelope wrap package, and you can see here that she's opening this in a manner that she's not contaminating it. This bottom side lays against the hard surface, but the inside of this packaging is considered sterile, so it creates that sterile field. This is a sterile drape. If we are creating a sterile field using a drape, there is a certain way that we will open this drape and lay it out. And I will go over that in lab, but I do want you to follow the steps in your book. I do want you to follow the steps in your book and know those as well. So we will go over how to actually use a drape and take that drape out of that package to create the base of your sterile field. Also, we're going to talk about pouring liquid into a sterile container. So we've created this sterile field here that you see. We have a container that we're cleaning this wound that has to be a sterile dressing. So we have this container. There's a certain way that this liquid has to be poured into this container. You want to make sure that you lip that bottle. So you're going to create your sterile field. You're going to drop your supplies, drop your sterile bowl. Then you're going to open the liquid. You're going to pour the liquid into the trash can, pour just a little bit, and that's called lipping. And then you'll come over with the same side and pour the remainder of the liquid into your bowl here. And then you will start adding other supplies. The last thing that you will do here is put on your sterile gloves, because if you put on your sterile gloves first and you grab this container, then you've broken sterile field. So one of the last things that we do is put on those sterile gloves. And then, of course, we're going to go over how to don sterile gloves in labs in the lab class. But with that being said, guys, I want you to go ahead and go through the chapter 2, go through all of your boxes, go through the entire chapter. You will need to know the steps for this procedures for your test on Friday. If you have any questions, please let me know.